An Atlanta man is dealing with the consequences of a botched chemical peel. What happened and how could something like this have been prevented, and what can be done to treat it once that occurs? I'm Dr. Dustin, board certified dermatologist, and I've helped millions of people through social media to make better educated decisions on their skincare and skin procedures with dermatologists. My goal is to help you save money when you're purchasing things over the counter and to be better educated when you do go see a dermatologist so your visit is the most effective and cost effective that it can be. Today we're covering the story of Neyo White. Neyo White is a man from Atlanta who went to a med spa to have a chemical peel performed and had some pretty bad consequences. Neyo shared his story through TMZ, and we're going to look at that today.
So basically, before she put the actual chemical peel on, which is a acid, she, puts, this other stuff on my face. And so, like cleaning my face, I guess prepping it for the chemical peel. And then after she puts all that on, then that's when she finally puts the acid itself, which is the chemical peel.
Okay, so we can see right now that he's got some hypopigmentation, some whitening on his forehead, down his nose, and over the cheeks. As he's talking about the process of getting a chemical peel, he talks about the preparation. And when we're preparing to deliver a chemical peel for somebody, we do have to clean their face. We want to remove excess oil and dirt from the skin, obviously. That will help to reduce the risk of an infection. To continue to prepare for a chemical peel, we'll also sometimes use ingredients like alcohol, like an alcohol wipe or rubbing alcohol on the skin, as well as acetone. And what these do is they are really effective in removing the oil from the skin. We do want to strip that away so that the chemical peel can really penetrate to the depth that it is needing to penetrate to. If you attempt to do a chemical peel professionally on somebody without removing that excess oil, you're really not going to see the type of result, or you're going to get uneven penetration of the chemical peel. So it sounds like he went through a pretty routine type of preparation process before the chemical peel was applied. I don't see necessarily anything wrong here in the steps so far.
On my skin. And then it starts burning. She's like, you'll be fine. She said it's supposed to burn. It was kind of very intense.
So the chemical peel was applied, and it sounds like he started feeling pretty warm right off the bat. Now, I don't know which chemical peel was used, how intense or strong or concentrated it was, but if we're going for a medium or a deep depth chemical peel, it's gonna feel pretty spicy. That's totally okay as long as that's what you've prepared the patient for. And again, I don't know what he was prepared for, what goals he had beforehand. So if you're getting a chemical peel, you should definitely know what level of aggressiveness is the peel. Does it match the goals that you have for the peel? Will it be consistent with the amount of downtime that you are planning on having?
It felt like, like rubbing alcohol on my skin, but like 3 times more painful. After she's finished getting doing the chemical peel, my face is white and gray. And
okay, so white and gray after a chemical peel can be a totally normal result from the chemical peel. One of the more common chemical peels that I do in the clinic for patients with intense sun damage and lots of precancers on the skin is something called a TCA peel, and I'll often do that at 35% or higher. Trichloroacetic acid is a modified version of vinegar. Vinegar is acetic acid, so these modifications with the trichloro groups will significantly increase the strength. What we're looking for is an effect called frosting. And this is described by dermatologists as a Rubin frost, Rubin level 1, 2, and 3. So a Rubin level 3 frost is like confluent white appearance to the skin. And that means you've got a very even and fairly deep penetration, and the top layer of the skin has essentially been killed by that chemical peel. A Rubin level 2 frost is going to be somewhat patchy and confluent in some areas, and a Rubin level 1 frost, you're going to see, a fair amount of skin still between small areas of a patchy white color. The fact that he had significant white and gray color on his skin tells me that he may have had a TCA peel that was fairly strong. So seeing that white color is what the peel is supposed to do, but again, I'm not sure if he was prepared for that by the individual performing the peel.
So I asked her, I said, hey, aren't you gonna remove this off my face? She said, oh no, you'll be fine. She said, it'll dry up, a few minutes later, or maybe a few hours later.
Okay, so not removing the chemical peel from the skin, is that a mistake? Well, there's certain types of chemical peels like glycolic acid when you get to higher percentages that need to be neutralized. If you don't neutralize them with a base, because you're using an acid, so you can use a sodium bicarbonate spray, or even just tap water often is enough, or distilled water. You need to neutralize it or it will keep working on the skin. It will keep doing its thing and can increase the depth of penetration where you're getting more and more result. So certain types of peels have to be neutralized. However, things like a TCA peel don't have to be neutralized. They're considered self-neutralizing peels and you don't have to wash them off. Oftentimes in my clinic, we will apply a cold towel, a cold wet towel to the patient if we're doing their head or their face, just because it feels really good after the intensity of a strong chemical peel.
So basically, I come home, everything is fine. It goes from white to gray and it gets darker and darker. So I'm like, okay, that's fine. She did say it was going to start to get darker.
Okay, so this process, again, still sounds fairly normal for a TCA peel, and it's the type of thing that I prepare my patients to experience. When they leave the clinic, they're going to be very, very white, bright white from that chemical peel. And then over time, it's going to start to get darker and darker. As the skin undergoes changes, as that inflammation comes up, over time it should turn gray to brown, and that brown really indicates that the peel is done, and the skin is dead and will start to peel off. And this is going to happen over the period of 1 to 4 days. So I don't know again how strong this peel was, but it sounds intense.
So then a few days later, that's when I started seeing like little spots on my face that look like burns. I did not do this for any type of clout chasing or views or any of that. People also saying, oh, he created a GoFundMe account, so he's trying to scam people. I created the GoFundMe account because I have to pay out of pocket, for Ubers to the burn specialist. It's all the way out in Cobb County. I'm in Atlanta, so that's 45 minutes away. Then I still have to pay other fees, medical fees after the insurance covers what, they're going to cover.
So I don't get the impression at all that he did this intentionally for clout chasing. This sounds like poor education on the part of the individual performing the peel. But again, I wasn't there. I don't know what kind of education or planning went into it. It really sounds like this was not his expectation after getting a chemical peel. But he's going to need to purchase certain aftercare products to help take care of this. He's seeing other specialists to help make sure that his skin can recover the way that it needs to. So I think the fact that he set up a GoFundMe is not a red flag in any way.
I actually am going to be taking legal action. I've also have had, a few attorneys reach out to me, but I don't want to just rush into it and just get any attorney. So I'm definitely going to pursue some type of legal actions, because I feel like denying my Cash App request and not responding is basically, a sign of action saying, I have no remorse, I don't care. Action speaks louder than words.
So it sounds like this individual was not prepared for the type of result that they were going to get. I don't know how long it's been in this video, but he still has a fair amount of white discoloration to the skin. So my assessment is that this was too strong of a chemical peel for him. When you have darker skin types, you generally have to be so much more careful with laser treatments, with chemical peels, because the risk of hypopigmentation and hyperpigmentation really increases. It also sounds like he went to the med spa first with his concerns, and if they had properly taken care of him and just refunded the money, I don't know that he would be seeking any national attention. And so that kind of goes to show the type of, customer service and care that one should provide when they're taking care of patients, because complications can happen to anybody. And so it's really not my intention to throw whoever this provider was under the bus, but complications can happen to anybody. And if you're practicing medicine or aesthetics long enough, something's going to go wrong, because patients respond differently to different treatments. Maybe they had done that exact same chemical peel on other individuals with darker skin, and they just didn't respond in such a negative way, but this individual did. And so it's all about the way that you take care of somebody before, during, and after, and it sounds like there may have been some gaps in this particular level of care. Hopefully this experience tells you that if you're going to get something done like a chemical peel, you should be going to a board-certified dermatologist or a place that is supervised by a board-certified dermatologist. These can be very serious treatments, and if there are complications, you want to know that you're in good hands. Anybody can add a chemical peel to the face, but not everybody knows how to take care of the aftercare and potential complications that come up. So seek out a board-certified dermatologist by going to the Find a Derm website on the American Academy of Dermatology page. I'm Dr. Dustin, board-certified dermatologist. If you found this entertaining and helpful, share it with somebody else, and make sure that you hit that subscribe button. I'll look forward to seeing you back on the next episode.